I'm Julio Capo, and let's queer up health. HIV meds saved, for now. Florida halts ADAP cuts. Florida health officials are hitting pause on a controversial plan that could have cut off life-saving HIV medication for thousands of low-income residents after a legal challenge from advocates. Earlier this month, the Florida Department of Health announced plans to sharply reduce eligibility for Florida AIDS Drug Assistance Program, or ADAP. The proposal would have dropped the income limit from 400% of the federal poverty level to just 130%, potentially stripping access to treatment for as many as 16,000 Floridians. That move sparked swift action from the AIDS Healthcare Foundation, AHF, which filed a complaint alleging the state failed to follow required rulemaking procedures. AHF also filed a separate lawsuit seeking records tied to what it calls a, quote, undocumented $120 million budget shortfall, end quote. Now the state appears to be backing off its March 1st deadline. According to local reporting, the department has published notice of proposed rule changes, triggering a mandatory public review period. AHF's Esteban Wood said the delay proves, quote, the department's action makes clear that legal processes have not been followed. Floridians will now have a say in what happens to this program and its effect on them. It will also provide needed transparency, and the department has not shown why it needs to make these harmful changes and show how it now has a claimed $120 million deficit, end quote. The fight comes amid broader concern over HIV funding following proposed cuts during the Trump administration and rollbacks to USAID programs. Researchers warn this could have deadly global consequences. For now, advocates say transparency and treatment remain on the line. This is so incredibly serious and so dire. And I have to say, just to start, so grateful for AHF for the work that they're doing to advocate for not just those 16,000 people who would, but for all of us, right? Because this is healthcare.
Yeah.
And once they come for one of us, they come for all of us. This is treatment is so necessary, and prevention is so necessary, right? There is what we're doing globally with these kinds of decisions with USAID, which is mentioned in the story. We're already seeing the consequences of that. It's dire to see it happen so at our local level and our state level. So thank you to the nonprofits. Thank you to we have so many great folks here locally, from SunServe to Broward House. Thank you for all the people who are doing the work on the ground to make sure folks are informed and making sure they have access in this really, really
and that they're still
moment.
Supported. You know what I mean? There was an emergency meeting done by AHF right here at Sunshine Cathedral that I went to last week. Right. And all the nonprofits were there represented, and everybody had questions, and there were people that were scared for March 1st to get here and for them to lose their meds, and they had real dire questions. They were worried about their health. Folks that had been on their meds for years, for years, you know, not being on this particular med for a couple of months is not even like an option, you know, like
in this moment of economic crunch, when people are hurting so much, and to think like this moment of high inflation, to think and then to say also you won't have access to life-saving meds. Yep, it's dire.
It's a really serious thing, and you know they want to bring it down to where people only making like less than $12,000 a year.
Yeah, it's $20,345, which is about $1,300 a month, which who can live on that?
Poverty. Like the idea that poverty is somehow changed. I mean,
yeah, and I believe right now it's set at like around 70,000, I think, which is a reasonable number, but we have to remember these drugs cost thousands of dollars monthly. And I know some of the people that were on this program, like they also have to, like, some of them have to switch medications because the state doesn't want to cover like this medication, they want to cover this medication instead. So they're forcing people to like switch medications, and that's bad. Like if a medication is working for someone,
of course,
you can't screw with that.
That's not how it works.
And sometimes a generic won't work for certain people.
Absolutely.
All sorts of reasons.
Absolutely. So it's terrible, and I really, really hope AHF is doing a great job. And if it happens here in Florida, it's going to happen elsewhere. So we need to all be in this fight together.
Yeah, but this is not generosity that they're trying to give us a handout and allowing for this to happen also. Don't take that, you know, don't get it twisted either. You know what I mean? This is also against the law to do something like this and give people a month notice, you know. The folks at this emergency meeting were telling folks to get a 90-day supply of your meds just in case, Like, you know, just protect yourself in case. You know, the unknown is the unknown.
All of us need to be up in arms about this. This is enormous.
you know. So there is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.